This is Dr. Brent Wright discussing, will I have twins if my husband is a twin? Well, twinning is a relatively uncommon situation in the United States, naturally occurring only about 12 per thousand in the United States. But with in vitro fertilization, we have much higher twinning, 35 per thousand, but those are all artificial. What we know genetically is that the maternal may have an impact. If there's a genetic relationship on the mother's side, there may be some increased incidence of twinning in those patients, but on the husband's side or on the paternal side, that has not been shown evident in any cultures that we've been able to study. So once again, there are some factors that are modifiable, but most of them are not as related to twinning. Things that can do, we know that over the age of 35, there's a slight increased risk of twinning. As you've had multiple gestations or multiple pregnancies prior, that will increase your risk of twinning. Of course, if you're Asian, you have a lower risk of twinning. If you're African American, you have a higher risk of twinning. And if you're living some places in Africa or in South America, there are certain regions that have increased incidence of twinning. And these may be related to the use or dietary consumption of phytoestrogens, probably one of the few things that may be a modifiable risk factor. So once again, if your husband is a twin, will not increase your risk of having a twin. This is Dr. Brent Wright on, will my husband's a twin, will I have a twin?